Hi, everybody. Welcome to another episode of Just Press Play. I'm really excited to have the CEO and co-founder of Tuned Care with us, Danny. Thanks so much for joining us on the show.
Wonderful to
Um,
be here. Thanks for inviting me.
of course, maybe let's start. Can you just tell us a little bit about yourself? Your background has just involves a really impressive story of classical music meeting, digital health. And you tell us a little bit about your passion for it and how you came to co-found Tuned.
Absolutely. So formally, I'm a musician. I have a degree in music composition from the Tel Aviv Academy of Music. I started playing music at a very, very early age. Did a degree in music composition, old school writing scores, kind of modern music kind of stuff. Started a very, very small studio in my living room. This is like late 80s, early 90s. That studio grew to be Israel's largest post production sound studio. Six studios, 15 engineers, and did a lot of work in terms of sound design, working with advertising agencies, feature films, documentaries, TV shows, stuff like that. Did that for 20 years. So basically, sitting in a room with no windows, 14 hours a day, and obsessively tweaking EQ and doing sound design, but also music production. Um, and I was also a tank commander in the Israeli army, and like every vet ever, I have moderate hearing loss and tinnitus. And I started experiencing kind of hearing loss when I was in my late 30s, early 40s, and really started diving into the wonderful, wacky world of hearing aids and audiology and hearing care. And what I found was within our challenging and messed up category of American healthcare in general, we have one which is even more challenging and messed up, which is hearing care. And we kind of started out by actually developing technology which we've patented around being able to do like hearing tests within a headphone and compensation algorithms for that. But then we kind of realized that what we are really interested in is change at scale with hearing care. It's not about a particular product or service. It's more about how do we affect change at scale so that, a decade from now, hearing care will be in a completely different place than it is today. And I'll go into that in a moment. But that's kind of like my professional background is in sound design, music, and now with direct to consumer kind of stuff and kind of a deep dive into the world of hearing care and audiology.
Wow, what a fascinating career you've had, Danny. Maybe just to continue the thought process, like what does rebuilding hearing health look like in
That's a
today's world?
It's a great question. So we first of all there's a couple of things here. One, hearing is like has an interesting connotation for people. Hearing is I always do it like an example. Like if I do this, we still have a conversation, right?
Mhm.
Because you can hear me and it's all good. You can't see me, but you can definitely hear me. But if so, the ability to hear someone is a fundamental communication capability. Like every job description you've ever seen is great communication skills. Hearing is critical for communication. We hear with our brains, not just with our ears. It is a fundamental skill and ability that has been kind of neglected and is perceived by people and has been for many decades as it's like hearing equals hearing aids equals old people,
Mm.
which is completely and absolutely fundamentally wrong.
Mm.
The first test that you get as a newborn is a hearing test.
Right.
And then you get a test, you're supposed to get a test while you're in school. But then suddenly between the ages of 18 and 65 or 70, it's like, it's all good. No issues there. And then when you're at 75, it's like, oh, you need a hearing aid because you have severe hearing loss. The reason for that is complex, but to kind of simplify it, we have had there's the old saying that says, when the hammer is the only tool in your toolbox, every problem is a nail.
Right.
For decades, for hearing care, the hammer was hearing aids.
Mm.
Hearing aids are amazing, super sophisticated devices, that are aimed at people with moderate to severe hearing loss to help them understand speech better. That's what it does.
Mhm.
It doesn't fix your hearing. It helps you understand speech better, and it is aimed for usually people with severe hearing loss.
Right.
That is, out of the 50 million people in the US estimated that have some form of hearing issue, that is less than 10%.
Mm.
90% of people have either, like myself, mild to moderate hearing loss, so I'm not a good fit for a hearing aid. So it's mild to moderate hearing loss, tinnitus, which is ringing in the ears, auditory processing disorder, which is a massive issue that I'll explain in a second,
Mm.
vestibular, which is balance issues. There are many, many, many other facets for hearing care, but for decades the focus has been on hearing aids. Not
Mm.
only that, but the business model was the only way that an audiologist would, or the 99% of the way that an audiologist gets compensated is selling a hearing aid, because all of the actual services are bundled into the actual sale of the device. Not
Right.
only that, but we now have a vertically integrated industry where the manufacturers actually own the clinics.
Oh.
So if you're going to a hearing, if you're going to an audiologist clinic, it is more than likely that you're going to an audiology clinic that is owned by one of the manufacturers, which is, by the way, why they will only show you one type of hearing aid from one specific manufacturer.
Mm.
So it's a business case of how an oligopoly basically creates a regulated oligopoly, creates a situation where the devices are extremely expensive,
Right.
the entire process is very, very difficult, and it only treats a small sliver of the entire kind of issues that we're looking at hearing care. Now that is kind of where hearing care was when I started kind of looking at it myself and my co-founders. And what we see is this is probably the most exciting time to be in hearing care in the past 70 years.
Mm.
Because what's happened is that technology has finally caught up and regulation has finally caught up. So
Mm.
where once the only hammer we had in the toolbox were hearing aids for people with severe hearing loss, we now have incredible products and services for people with mild to moderate hearing loss in the between $300 and $500 range, which are clinically validated, incredible devices. Regulation in terms of introducing an entirely new category of hearing care products, which are FDA approved over the counter hearing aids, are hitting the stores on October 17th. This is something that we've been looking at for the past 6 years. Incredible bipartisan work by Elizabeth Warren and Senator Grassley, and have pushed that through, and that has really changed the landscape. We now have finally software coming in. So software that is able to do what traditionally only hearing aids were able to do. Companies like SonicCloud, like Otto, like Cinebot, Mimi, incredible company out of Berlin, are able to help people with all of these types of issues that I've talked before, where the average price tag is in the low hundreds of dollars.
Wow.
Now, this was inconceivable 6 years ago,
Mm.
a decade ago, but now, when somebody comes to us, like the typical person who comes to us, who's an employee at a company, average age is 42, they have mild hearing loss or moderate hearing loss, work from home, use headphones all day long, I can literally offer them 9 different solutions, from apps to services to different types of headphones and earphones. Even the headphones that I'm using right now are personalized to me.
Mm.
So they actually gave me a hearing test, and they personalized to my own sound. Beautiful. You wouldn't never think that this has anything to do with hearing care. But somebody like me that has moderate hearing loss, what that means is that I have a little bit more difficulty under or hearing the difference between bad and dad. So I need to do a little extra cognitive work if I'm not using this type of device to differentiate, for example, bad and dad. So
Mm.
now imagine me using AirPods for 9 hours a day on Zoom calls.
Right.
You're exhausted. It's exhausting. And again, once there was nothing you would do. You'd go to an ENT or you'd go to an audiologist. They would say, "You're not a good fit for a hearing aid. Come to me." It completely reactive kind of category of healthcare, which is come to us when your problem is so bad that it is severe hearing loss, and we'll fit you with a hearing aid.
Right.
So that's kind of one part of it. Another part of it is how do you the addition of telehealth, where for us, I think there's it's kind of a buzzy word, and I sometimes see like startups that are using telehealth, and I'm like, don't really get it. But in I think in our case, both of our companies' cases, telehealth is a fundamental part of the business because for me, 60% of counties in the U.S. don't have any audiology clinics at all.
Mm,
Texas has 230 counties, 180 do not have any audiology clinics at all. Even if you wanted to go somewhere, there's nowhere to go. So for us, the ability to make hearing care accessible to people through telehealth is a massive shift. So maybe after all of this this is all the ingredients that we were looking at when we were thinking about hearing care, and what we came up with is Tuned. Tuned is a platform that is, think about it like a virtual audiology clinic. So we have almost 200 audiologists across the country. One thing which is a basic tenet of Tuned is that we believe that it needs to be led by audiologists.
mm,
From a clinical perspective, from an ethical perspective, the person leading you through that hearing care journey is an audiologist, is a specialist. And there's a difference between an ENT, which is an ear doctor, and an audiologist, which is a hearing doctor, which are two different things. So we built the entire company around putting the audiologist front and center. So our goal is to put you in front of an audiologist after you go through a screening process. We have the most advanced hearing screening capabilities today, I think, in the world. It's multiple tiers. It takes about 15 minutes to do. You do it in the comfort of your own home with a pair of headphones. You go through different types of questionnaires and different types of hearing tests. But then at the end, you sit down with a doctor of audiology and you say, and you look at the results of your screening and you say, okay, you have mild hearing loss in your left ear, you work in a call center, or you do customer support, or you're in sales and you do this for 9 hours a day, you like over the ear but not in ear, here's 7 different options for you. And the most kind of salient difference between us and everyone else is that we are completely brand agnostic and completely independent.
mm,
Our audiologists have no skin in the game. They get paid for their time.
mm.
They literally there is no financial interest from their perspective if we just help you tweak your AirPods, because now with the iOS 16 we can upload your audiogram and tweak your AirPods, which is incredible. Or if you need a $6,000 hearing aid, they get paid for their time. So we removed the basic decades long conflict of interest that was baked into audiology, where you have a practitioner who is getting compensated for the sale of a device.
Right,
End of year report is units sold.
right.
So we removed that. Our audiologists get paid for their time, completely brand agnostic. You get access to an audiologist who will look at your screening and say, here's 7 different options for you. If you need a hearing aid, we will send you to get a hearing aid. If we see a red flag, you've had sudden hearing loss just in your right ear over the past weekend, we will send you to a clinic. So
Yep.
we offer a holistic, comprehensive solution. And the last component of that, because we are interested in making change at scale, we are very focused on B2B and getting employers adding hearing care to the basic employee benefit, which is dental and vision. Why don't you have hearing care?
Got it. Right. And previously you were direct to consumer in terms of the model.
We started out kind of direct to consumer. We started out even with a company that we founded before Tuned, which was actually manufacturing solutions and headphones and stuff like that. But again, we're interested in change at scale. And change at scale is creating a platform where all of these devices and services can live for the first time together with professional guidance and
Right.
a B2B go to market strategy, which is basically you're in HR, you're in benefits, you need to take a look at hearing, because right now 15-20% of your workforce probably have a hearing issue, and the only thing that is offered today is discounted hearing aids, which most people don't need.
Right. And so, Danny, are you sourcing the different products and services downstream as well?
Absolutely. So we work with, again, which is one of the joys of my work, is that we work with all of the manufacturers. We're seeing, I think, because we're positioned in a really interesting place at a really interesting time for hearing care, we're seeing a ton of innovation and startups and people doing awesome things coming to us and saying, because you have no skin in the game, you're not owned by anyone, and there's no, would your team of audiologists be willing to take a look at this? And the answer is always yes, we'd love to take a look at this and kind of guide you or vet you or see and offer it. If it's good enough, we would certainly be happy to offer it as a possible solution to our patients.
Fascinating. So really, I mean, not to put words in your mouth, but maybe because we're building a marketplace, so I see everything. I see the world as like almost marketplaces. Really, you're building this really fascinating marketplace where the value of the marketplace is providing access to experts who will help you decide on what to purchase.
Exactly. In a very confusing world where new things are coming out, and
Right.
people are kind of traditionally, again, they have this kind of preconception because that's what they've been told for decades, that hearing equals hearing aids equals old people.
Right.
And I'm
Right.
like, we now have, especially post pandemic, we now have entire organizations, yours and mine, which are work from home,
Totally.
where this is a work tool. Now, you don't need to
Right.
be a doctor of audiology to figure out that putting these things on for 9 hours a day is going in the long term to affect your hearing. And the
Right.
more we look at this, the more we see is, as I said, the ability to be really offer hearing care in a very different way that says hearing aids are great, there will always be a place for that, but that's for a fraction of the population.
Yeah.
What Tuned offers is a comprehensive hearing care benefit that takes into consideration mild to moderate tinnitus, all of these different things, and very ethical and guided by experts that can you know b- offer a solution to many different types of scenarios, budgets, as the case may be.
It's incredible. So, I mean, it sounds like, you're really changing this paradigm. You're trying to scale it, but then also you're really fundamentally changing people's perception of hearing loss.
That's a huge part of what we do. Absolutely. It is sitting down with HR. It is doing, we do a ton, I think we're like a content manufacturing factory. Like the amount of
Right.
stuff that we create every week, it's like blogs and posts, and we are telling the story of hearing, trying to make this connection, which people get once you explain to them that hearing is communication.
Right.
When you help your employees communicate better, that is by definition a good thing. When people don't have cognitive fatigue after a day, again, you have people within your workforce who have a hearing issue, and right now there's nowhere to go to, and there's nothing to do. It is not a rare issue. It is, if hearing loss was a recognized disability, it would be by far the most common disability in the U.S. And this is not just people who are 65, 70, and up.
Right. Yeah, no, I've never thought about it that way. And Dana, I know we're actually already running short of time, which
I
is kind
talk
of
too much
crazy.
as usual. I
No, no, no,
apologize for
no.
that.
I mean, I was just sitting here just listening, like, man, I've learned so much in the last, 15 minutes. But so speaking of kind of educating people, at scale and just changing the whole paradigm, I heard that you just struck up a partnership with this small organization called the Grammys.
Maybe people have heard of it. Yeah, it's
Yeah, maybe you've heard of it. Yeah. Tell us a little bit more about it. I mean, what an incredible partnership.
we're going to do like the actual official announcement in late October, but certainly I'm happy to share. Music Cares is the nonprofit arm of the Grammy Foundation. They're an exceptional, amazing group of people and an amazing foundation, and they are basically there to help people in the music and entertainment industry with their health issues. A lot of people are, it's the gig economy. They don't work for they don't have like a payroll. It's gig based, and when they have health issues, Music Cares it's been around since the '90s, helped literally hundreds of thousands of musicians, and it's a labor of love for me because these are my people. This is my background. This is where I came from. Music Cares has taken upon itself to partner with Tune to offer all of its members pre-approved access to a yearly consult with an audiologist, earplugs, and if the audiologist deems that this is like clinically validated, access to any type of hearing aid or over-the-counter hearing aid, which is all funded and paid for by Music Cares.
Wow.
It is their first big nationwide all-member proactive push. and we're already starting to see people. I can't tell you, these are people who have never seen an audiologist.
Wow.
Music, this is how they make a living, literally.
Yeah.
They've never spoken to an audiologist. They've never had their hearing tested. And again, there is so much we can do to them because of the advancement in technology. This isn't a $6,000 solution. It could be a $200 solution. And Music Cares has incredibly stepped up to really offer this to all of their members, which is a really, I think, a game-changing kind of partnership, and something that we're very, very excited about.
Wow. That's incredible. I'm just like, it gives me chills a little bit, actually, just thinking about the fact that your work, may improve the quality of music that is created in the
Or
world.
people who make music, and it's not just the musicians. It's the, you go to see a show, you see the photographer running
Right.
around. That's, you see the, the people who do the back of house people, front of house people. There are many, many people who make these things possible for all of us to be able to enjoy the beautiful things that they make. But it's taking a toll, and up until now it's just kind of like, yeah, well,
Yeah.
let's wait until you get severe hearing loss, and then we'll fit you with a hearing aid. And we're coming in and saying there's conservation we can do. It is not your fate to have
Right.
severe hearing loss. We can help with that.
Right.
But it takes that awareness, and honestly, that's something that I've not only taken upon we as a team, but it's something that we embrace. We love telling the story. We love sharing it, and we love seeing that light bulb moment that goes off when people are like, "Oh, well, actually, my ability to hear other people is kind of important. Maybe I should do something about
Totally. Well, you definitely helped my light bulb go off.
it."
This has been incredibly compelling. I really appreciate you coming onto our show and telling us your story in this.
Thank you so much, and we're so excited about this partnership with Buoy. And I think, to my mind, this is really part of it. It's being able to, when somebody goes in and looks for something, or is looking for information, looking for data, looking for a path forward. I think this collaboration between the two companies is really going to help people get access to experts that can actually help them in an objective and kind of like effective way.
Yeah, no, thanks so much for saying that, Danny. Where can people find you in our last minute here? On Twitter, LinkedIn, and one
LinkedIn.
last question is, what's your favorite song to kind of recommend
Oh,
to someone who's looking for new music?
so I wouldn't say a favorite song, but I would love to turn people onto a Pulitzer Prize winning composer. Her name is Caroline Shaw.
Mm.
She is part of the group who has the greatest name ever for a vocal group, which was Roomful of Teeth, and which is genius. She's a genius composer. I was just here in Brooklyn. I went to see a concert of hers last week. Do yourself a favor, go onto Spotify, type Caroline Shaw, give yourself 30 minutes. I promise you won't be disappointed. She is a legend.
Fantastic. And Danny, remind us again where people can find you.
TuneCare.com is the website. You can find us on LinkedIn. We do, as I said, a ton of content. Go into our blog. We have a whole group and team of audiologists who really kind of help tell the story of hearing care. What does it mean? What does it mean in the workplace? Equity in the workplace. A lot of stuff. And take care of your ears. They deserve it.
Thank you, Danny. This is amazing. Appreciate you coming on. I hope you have a great rest of your day,
You
and
too.
thank you again.
Thanks again for inviting me.
Of course.